Peter Hotez now, co-director of the Center for Vaccine Development at Texas Children's Hospital. Doctor, as always, thank you. How concerned are you about this uptick in cases in the country? And should Americans be worried in any way about the possibility of another shutdown at some point, like we're seeing in European nations?
Well, we are seeing a pretty sharp increase now in cases in Michigan and New York, New Jersey, and Rhode Island. Exactly what the basis of it is, we don't know. We're concerned that it could be finally the rise of the B.1.1.7 variant that we've been saying is going to cause an uptick, and it may finally now be happening. So this is what we're looking at right now, and the key now is to vaccinate ahead of the variants as fast as we can.
It got heated on the Hill today, Doctor. Senator Rand Paul and Dr. Fauci had a bit of a face-off over what need for masks and vaccination.
You've been vaccinated, and you parade around in 2 masks for show.
No.
You can't get it again.
Let me just state for the record that masks are not theater. Masks are protective.
It's really pretty incredible what's going on the Hill. What's your opinion on this, Doctor?
Yeah, Senator Paul has been very provocative about masks since the very beginning. He doesn't like the idea. He's uncomfortable with the idea. And eventually, we are going to reach a point where when everyone is vaccinated and transmission rates are way down, masks may need to come off, but we're still trying to understand the full performance characteristics of the vaccines. We're only now getting a glimmer that it interrupts asymptomatic transmission. So Dr. Fauci is absolutely right. Senator Paul is absolutely wrong, and that's the way it's been for the last 14 months.
Yeah, we've noticed. So on schools, the CDC officials announced that they'll soon revisit the guidelines for students in schools, including whether 3 feet is just as safe for distancing as 6 feet in the classroom. What changes are due, Doctor?
I think everyone focuses on the number of feet, and that's only one of the factors, because it really very much depends on the level of ventilation in the classroom. If you're a well-ventilated classroom, 3 feet may be adequate. If you're in a poorly vented classroom, because this is an airborne virus, even 12 feet may not be adequate. So it depends on that. It depends on the level of mask wearing. It depends on how the teachers and staff are vaccinated. It's hard to just point to a certain number of feet. But one thing is clear: as we start vaccinating teachers, as we start vaccinating staff, classrooms are going to become a lot safer. And then as we move into the fall, I think we'll have the adolescents vaccinated, so junior high schools and high schools will really be in good shape.
I know parents and Shepard Smith here. Thanks for watching CNBC on YouTube.